Have you been searching for pain solutions that don't involve incisions, addictions, injections, medications, or complications? If yes, this podcast is for you. Pain Relief University's hope for everyone is that you stop suffering needlessly and experience relief naturally. May this podcast provide you the combination of remedies that make pain-free living your new reality. Let's get started. All right, here we go. So, first, before we even get started, I would say you have been one of the most influential people in my Grenada Nut Company journey and in my personal life. So I want to say thank you for that. And thank you for being the first person that we interview on the Pain Relief University podcast. For those that don't know, this is Dr. Katherine Sylvester, physical therapist, and been in this space for over a decade now, right?
Yeah.
Matter of fact, why don't I do this? No one could probably tell your story better than you. So you tell your story, and then let's just hop right into it.
Well, thank you for having me on, first of all. But yeah, I've been a PT for 10 years, and I have mainly worked in the hospital with patients that have brain injury, spinal cord injury, stroke. I did that my first 5 years. And then this next period of time, I've been working with moms, and I help them, if they leak after they have their babies, I help them get rid of that leakage and help them out with if they have any issues having sex or losing weight or
Wait.
tighten up their
Let's
core
not
or
gloss over it. You help them out with having sex. Like,
ah!
let's go there. what what are they? What kind of problems are the ladies having that you, as a physical therapist, are helping them with?
That's such a good question because, a lot of people don't even think of us as working with people who have those types of issues. So, if they have decreased intensity of orgasms or they could have pain with sex, it could either be upon insertion or with deep penetration. Sometimes orgasms are painful and that can cause issues. But the reason is that sometimes they will have issues when they deliver their babies vaginally. Then they can have some nerves that are compressed during that time period. And then if they have scar tissue from having a C-section, that scar tissue can attach to different places underneath their pelvis or within their pelvis, and that can cause them to have pain with
But wouldn't a
sex as
doctor
well.
catch that? Like when they go back and doing all their checkups?
That's a really good question. And to be honest with you, you would think that they would. And some doctors who are super thorough do. But there are a couple of things. One, a lot of doctors will just say, oh, that will go away. And
Mhm.
so you never end up going back to that doctor because you think it's going to go away. And when it doesn't go away, then you just think you're one of the people who it didn't go away,
Oh,
right?
that
And then you see other
sucks.
moms who have those same issues. And so then you just think, oh, okay, it's normal. For my personal checkup with my OBGYN after I had this baby, he touched my knee for my 6-week checkup. So normally they will do an internal assessment, yeah, and check to see if everything's still in the right place. And he asked me, are you doing better than you were after you had the baby, right? And I was like, right. And that was it.
Okay, maybe I'm
That was it.
misunderstanding something. To make sure that you were internally fine, he touched your knee.
He touched my knee as oh, that's good that you're doing well. Yeah, never went inside to check. And the internal assessment is what you need,
Mm,
right? So when you first have the baby, you don't want anybody in there, right? But
right.
at 6 weeks, you want to know that everything is everything,
Oh yeah, because it's
right?
6 weeks. It's time to go.
Oh, honey, yeah, it's long past time to go, but the medical industry says that it's time to go at that point, right?
Got
So
it.
yeah,
Okay.
it's problematic.
All right. So, if any women out there listening and you've had decreased sensitivity towards sex or even painful orgasms or things like that, they need to come see you. But are there some things that they can do prior to come seeing you? I mean, this is way left from where I was planning on going, but I think for the people who are coming
It's
here,
important, right?
it's important, right? And it's still pain relief, right?
Mhm.
If you're having painful sex, it makes you not want to have sex, and that causes a whole bunch of other problems. So for the woman who is past 6 weeks from having her child, be it the first or the seventh, and she's having painful sex, and so now she doesn't want to have it, are there some things that she can do before coming to see a physical therapist that can help? Or do you recommend, hey, immediately go see a physical therapist, go see a doctor?
So I think there are two things. So one, a lot of moms who are going to have C-sections, they find that out early on in the process, right?
Okay.
And so before they have their baby is something that they should be thinking about. So right after you have the baby, you can desensitize the area around the scar. And so you know where the scar is going to be. Typically it's around the bikini line. And moms can go ahead and get like a silk scarf and they can go around the incision area with that scarf because that desensitizes it. If you ever talk to a mom, and I won't say all moms who have C-sections, but a lot of them, the clothes going over the scar bothers them. And so if they can just use, right? And you think about it, like the material that I'm wearing now is more like woolly. That does not feel good over a scar, right? Or an area that is around an area that has had a scar. And so they can desensitize that area with different materials. I recommend starting out with silk or satin, and
Right.
then within a couple of weeks moving on to like a pillowcase type of material, and then after that like a washcloth type of material, and that desensitized the area so that when the your husband is trying to touch you in that area, you're not cringing, because if you associate foreplay with pain and you're not a pain type of chick, then you're not, then your brain is like, I don't want any parts of that, right?
Right.
And then you
Right.
wonder why over time a woman's libido will go down, but it's like that same area that was sensitive. Her person has been touching that, right? And so she can go ahead and desensitize. And then from there, I would say then you want to call in a PT. The other thing though is that if a mom is getting out of bed the wrong way or getting up and down the wrong way, then that can cause chronic pain across that scar. Or if she's had a vaginal birth and she's had those nerves compressed, then her standing up the wrong way can cause pain. The reason that I think she should have a PT to assess her if she does not have an OBGYN that has done a thorough assessment is because sometimes organs can move out of place during pregnancy. And so
Got
whether
it.
you've had a C-section or vaginal delivery, if those organs are out of place, it puts pressure on the pelvic floor and can cause pain in the pelvis. And so if you are then, can you imagine you have an organ that's sitting lower than it should, then you have a penis that's coming in. It's hitting the organ, or it's hitting the scar tissue, or it's just extremely painful. And so getting that organ back into place is what we help with. So if we strengthen the pelvic floor muscles, then those organs are not pushing down. So then it's out of the way when the penis comes in.
Oh, so the
Right.
guy's thinking he's doing a good job, but in actuality, the organs are just out of place.
Yes,
Okay,
yes.
got it.
Halftime they ain't doing a good job anyway.
Hey, hey, hey,
I'm
hey.
just playing. I'm just playing.
We're doing the
I'm
best
just
that we
playing.
can with what we have. So,
But the other thing is vaginal dryness. And so our hormones are kind of off after we have babies. And so sometimes, especially if a woman is breastfeeding, she can be dry down there. And so the wetness is what makes it pleasurable for her. And so if she's dry and she's still trying to have sex, then that can cause pain too. And so just attending to her diet and just making sure to drink enough water. PT can help them figure out some things to put down there so that they can replenish that wetness without causing problems to the baby, because the woman who's breastfeeding is not going to take estrogen, right? Because it
right,
can be passed to her baby through
right.
breast milk. And so I can just show her ways to keep that area moist so that when she does have sex, it's still pleasurable.
Oh, no,
And
that's
so
awesome.
she can be, yeah, just stay hydrated. If she were not to go to a physical therapist, that would be the first step, I would say.
Okay, no, so okay, and so I want to put something in context. So for my audience, in terms of you, like you've
Hmm.
helped a bunch of people that I know. You've helped my mom after she had both knees replaced, and she was in a dark place, and she was an OT, as you know, um, but you were able to will her back to a mentally good place, and then physically give her a regimen that was specific to her. And I've seen you do that with my wife, Danette. I've seen you do it with a bunch of other people. I mean, heck, you even done it for me when the times that I've injured something. Talk to me about your approach when you meet a new patient, because I think it's different how you deal with patients. And then we'll get to the pain stuff, but I just think like how you approach it makes people understand the importance of your field. Because like I was telling you before I had the injury that required surgery in the military, I never even heard of a physical therapist. I didn't know that you guys existed. And then I couldn't tell the difference between a physical therapist and an occupational therapist. But after, the experience, and then now being in the same universe as somebody like you, I see the value in it. But but you particular, more than just you as a physical therapist going out there and restoring people, you individualize everything. So just talk us through that.
I feel like everybody is created so differently, right? And so just because, one person has had a knee replacement, the next person has had a knee.
Oh well, you ready? Let me know when you're ready.
Ready.
So just talk to me about your approach as you meet new patients, because I think it's rather unique, And I'll say it this way: most of the times when I go to a doctor, I can kind of tell exactly what they're going to do. They go through the same process, the same thing, and they give the same regimented response. Like for instance, recently, when I went to go get my blood pressure checked, and I knew what they were going to say. I knew what they were going to do. I knew they was going to try to immediately put me on blood pressure medication without looking at me. They didn't even ask my historical blood pressure measurement. I had to tell them, right? And so for me,
Mm-hmm.
that kind of lessens my reliability on doctors. But with you, from the experience I've seen with you, like you tailor it to the person, like you go in depth. So just tell me about the why you do that and how you approach it, and what kind of outcomes are you getting because you do this, and if there are any drawbacks for doing it this way.
So the why, when I started working, I was told as a student, you ask people these certain questions. And I heard students doing that, asking those same exact questions. So, can you tell me your name, your date of birth, and how many stairs do you have to get into your house? Do you live with anyone who can help you? Those four questions over and over and over again. And it was like sometimes there were more questions that needed to be asked, but
Mhm.
because they were so programmed to asking those questions, there was information that was left out. So I decided that when I did my own thing, I would have an hour-long consultation with moms before I even took them on as clients or as, I guess as clients. So I call them and get to know their journey through pregnancy, right? And their journey through their delivery and why they reached out to me. And what I found is that I could tell at the end, can I actually help this person? Is this person someone that I should see or should I refer them? And if I could see them, then that meant that they had to then continue on with that level of transparency. Because if you think about the pelvic floor, or the muscles that are inside of the pelvis, you think about sex, you think about people leaking. Those are embarrassing things that if you don't have trust between you and your healthcare provider, you will never mention it,
Yeah.
right? And so that's what I found is that the more I ask, the more they tell, the easier it is for me to treat them. Because then I can put all the puzzle pieces together. If you're only telling me a certain thing, then I can only go so far in helping you recover
Gotcha.
it holistically. And so I have to ask them the questions that need to be asked to the point where even if I don't ask, then they go ahead and tell me. And that has made the biggest difference for me. And so I might have a mom and I go to her and I say, well, what are you eating? And she says, oh, I'm eating this. And she's used to people saying, okay. And I'm like, no, send me a picture because I don't need to know, just what are you eating, but how much of what you're eating. What did you season it with? What are you drinking? When are you drinking? Right? Like, I need to know these things so
And
that I
for
can
all
treat
our
you.
viewers and listeners, this is the truth. This is what she actually does. So when I had my blood pressure every day, like the ingredients on the package list, I had to send. Like I was like, oh my God, this is crazy. But my blood pressure is back to normal without medication. So yeah,
Right?
that's awesome.
Right?
Yeah.
Thank you. But
So
that's what I'm saying is that, go ahead.
no, go ahead.
I was just going to say that when I have that information, then I can help moms because think about it. If I know that caffeine makes you leak, I know that. A mom might say, "Oh, I only drink 1 cup of coffee in the morning," and so if I gloss over that
Mm.
and don't realize that her cup of coffee is 36 ounces, then she doesn't realize that, hey, we could take that 36 down to 8, a real cup of coffee, and you could possibly not leak as much, right? And then moms don't realize that that glass of wine at night, that's not this much that they give you at the restaurant, but a whole glass of wine could be what's causing her to leak.
A
And
whole
so it's
bottle of
those
wine.
little things. Or a whole bottle of wine, yeah. could be causing problems. And so that's on the small scale. It's like if I look at a mom's diet and what she's eating, that can eliminate a lot of her issues with leaking, but also with pain. There are some women who have chronic pelvic pain and it's all about what they're eating. And so I can look at that, let them know what foods are inflammatory, what foods are causing your bladder to be irritated, because an irritated bladder can become a painful bladder, right?
Gotcha.
And so I love individualizing, because this other woman may not drink coffee. That might not be her issue, but her issue might be the wine, or it might not be the wine, but it might be the Coke. And so if I don't know those things, then I can't help them, because I can give them pelvic floor strengthening exercises all I want. And I can teach them how to modify how they get into and out of bed and into and out of the car, and how to strengthen their pelvic floor. But the other thing is that sometimes someone's pelvic floor is too tight. So if I talk to someone and they seem super anxious, then that gives me an idea of what their pelvic floor is doing. And a pelvic floor that's too tight does not want to allow anything in. So that can be the cause of painful intercourse, right? And it has a hard time relaxing to push a baby out. So if I'm seeing someone before they have the baby, I can teach them how to relax their pelvic floor, as opposed to just doing, squeezes at the traffic light, which is what everybody says, right? The OBGYN that says that, it's like she could be doing them at the light, and now her pelvic floor is so tight that she can't deliver a baby properly, right? And then she tears during delivery. So I just think that if you don't individualize someone's healthcare plan, then you're really doing them a disservice, right? And it's funny because sometimes, you talk with me about doing no harm. It's like you can do harm by giving someone the wrong treatment plan, but you can also do harm by not taking all of who they are into account when you treat them.
No, that makes sense. That makes sense. Let me ask you a question then. So I know I've been ODing on the women.
That's okay.
Fellas, I hadn't forgotten you too, because we have pains too. What are the typical reasons a person comes to see a physical therapist? Like what happened, and what kinds of pains do they have, and just things of that nature?
Gotcha. So a lot of times if someone decides to come to physical therapy, it is because they have some type of a pain. But in the hospital, a lot of the times it's an accident or something has happened and they couldn't breathe at home. So they come to the hospital with breathing issues, or they get into a car accident, they've broken bones, or they've had a stroke or a spinal cord injury, something that they cannot manage at home. So they come to the hospital. But in terms of, because there are so many different facets of physical therapy, which I think there are so many that we wouldn't be able to talk about all of them on the podcast, but
Okay, we'll
pain is what I think drives people. Thank you.
I'm on the podcast. I can do this as much as I want.
Yes, you can. And I love it. But yeah, most people will not go to therapy if they're not in some type of pain, right? And it's either physical pain or the pain of not being able to do something that they really, really want to do. Like I had a lady yesterday and she said that she put off, and I always ask people this because she had a total knee replacement. And I asked her, how long were you in pain before you decided to have the surgery? I asked everyone that. And she said 5 years. And I said, what made you decide to have the surgery now? And she said, my daughter is having a child and I want to be able to get on the floor with my grandchild and play with her. And I thought, pain it will drive you to make decisions, or you'll suffer with that pain and never address it, right? And people are on two opposite ends of the spectrum. Some people are like, I hate that I can't get down there with my grandkids, but they're not doing anything about it. And you have that other person who's like, I'll go through surgery and the rehab and everything that comes along with that so that I can be what I need to be for my grandchild.
Yeah, I think my mom, she waited, it was either 10 years or 20 years, I can't remember, before she went to go have surgery. And then once she got one knee replaced, within like 90 days, she got the other. I'm like,
right?
I can't.
Yeah. It's like when they experience that relief, they're like, why not? Why not do the other side? Right?
Yeah. Let me ask you a question then. So what separates you from an occupational therapist? Like, what are those differences? Y'all like, to me, like twins, but right? So
yes. We do, and I think it makes for the perfect marriage, to be honest with you, from between professions. So, as a PT, I feel that what I do is enhanced by what an occupational therapist does, and vice versa. And so, if you think about things like brushing your teeth, combing your hair, showering,
Mhm.
things that make you you and make you ready to get out of the house, that's what I think about with an occupational therapist, or something that helps you function in a specific role, like vacuuming or doing laundry. It's like, what things do you have to be able to do to be able to function in your role? And then with physical therapy, I feel like it is, you are rehabbing the person so that they can function in life. And whatever that means, so if it's strengthening your legs or strengthening your arms or getting your balance back, it is helping someone return to function in that regard. And it's not that an OT couldn't help with that. It's that an OT focuses more on the grooming, dressing, bathing. And because of that, people will say, oh, OTs do arms and PTs do legs. And it's just not the case. It's that, I know, it doesn't sound right.
But
It's
it makes
that
it
the
sound
things,
like that's how bad information gets passed around. Like it sounds, oh yeah, OT does arms and PT does legs. Okay, I got it, but it's wrong. Got it.
it's wrong, right? But because you use your hands to comb your hair, which is grooming, and you use your hands to brush your teeth, then you can think, oh, an OT does arms. But it's that you also need endurance to get to the bathroom
Yep.
to brush your teeth, right? And to comb your hair and stuff like that. So they work on that endurance and they work on helping you conserve your energy. They do a lot of that. They also help with, if someone has to take pills, organizing those pills so that they can take them and take them the right way.
Got
And
it.
so an occupational therapist gets there, right? Where PT, I think, looks at the total body system and helps you function in those roles, but also in roles outside of the home.
Gotcha. Gotcha.
And
Gotcha.
then OTs also, you see them focus a lot on driving and helping people return to driving. You don't always see PTs in that role, but they do that as well. So I think it crosses over a lot. But if I wanted to separate it out, I would say we help with life and they help you get prepared to do whatever it is that you want to do in life.
No, that makes sense. That makes a lot of sense. So let me ask you a question then. So you as a physical therapist, um, in regards to your industry, in regards to your industry's ability to take care of patients and return them and restore them to life, what keeps you up at night? What, and then what frustrates you most about just being a physical therapist?
So I love being a physical therapist. I love it. You
Yeah.
know that. I think that there are two things that frustrate me. One would be, or what keeps me up at night, let me say that, is trying to figure out what can I do to get people to get buy-in before they end up at the total knee replacement stage, right? So in your 20s, you want to run marathons. So a lot of people will run marathons, but never train the muscles that they need to run a marathon, right? They just get out and start running because most people will tell you, you want to run a marathon, start out doing a mile a day. And then in 2 weeks, go up to 2 miles. And in 3 weeks, go up to 3 miles. Nobody tells you to sit down and stand up, to strengthen those muscles, or to put weight on your legs and strengthen your quads, right? Like they want, it's like you think I'm gonna do this and my body will just adapt. Nobody tells you that low back pain may come with you pounding on that pavement, or to change your tennis shoes they'll say every 3 months. So I recommend you change your tennis shoes every 3 months. How do you know that I'm not wearing my shoes down every 3 weeks,
Mm.
right? Do I need inserts to accommodate for the way that my specific foot hits the ground versus, I may be flat footed and you may have a high arch, right? And
Mm.
so I want people to buy into being healthy before they get sick. And the fact that people don't bothers me, right? Because people don't understand why it's important to watch their diet. Or, I mean, and in theory, they do, but then if you watch what they eat, then they don't. And in theory, people, right? I know, I'm not
Because
talking
I
about
love
you.
my
I'm just
Reese's.
saying.
I love my Reese's. I love my gummy bears. Like
Uh-huh.
it's my
Hmm.
lifesavers. Like I understand, but
Uh-huh.
I'm drinking water.
I'm proud of you. I'm
But
proud of you.
I understand the struggle is real. The struggle is
Right. So as a PT, if I could make everyone buy into being healthy and knowing what that meant for them, that would make me sleep better at night. Right.
okay. Nah.
Now, in terms of, oh, go ahead.
No, go
You
ahead.
said you get it, right?
I do.
Yeah. I want to change that. And one person at a time, I feel like I am changing that, right? Because when I go into the hospital, I can help someone set, with their mindset because they come in and they have been injured. And now I can tell them, look, this is what you need to do. This is how long it may take. And then get their individual goals. So then I know that they'll stay on track to achieve that, right?
Right.
But then from a industry standpoint, I think that what bothers me is that people rely so much on pain medication or just medication in general to solve every problem. And so if someone says I can't sleep, then they go to a doctor who will give them sleep medicine. I'm in pain, they go to a doctor who will prescribe them opioids. I'm dizzy, they go to a doctor that's going to get rid of their dizziness. I have high blood pressure, right? And it could just be from a car accident. And then the doctor says, hey, let me put you on blood pressure medication. The problem is they put you on that blood pressure medication. Then you have an issue with, let's say, water retention. So then they're like, oh, let me get you something to get rid of that fluid. And then you're on something to get rid of the fluid that drops your blood pressure. Then they put you on a medication and put your blood pressure back up. And then it causes so many problems when we could just change our lifestyles. And
Right.
that would help. Right.
No,
So my biggest barrier is that people want me to condone them going on these diets and, drinking these shakes instead of just eating the right way. Right. Or exercising to get rid of pain. I have so many, and I respect surgeons who say, I'm not doing your surgery because you're overweight. Because the pain that you're having, yeah, you do have bone on bone issues, but if you didn't have so much extra weight on you, then your knees wouldn't be hurting the way that they are, right?
yeah.
And so why not just exercise to get rid of the pain? And I know that it takes a longer time, right? So if I say I need to lose 40 pounds to have pain relief, then people will say, oh, I'll just go have surgery and get rid of that weight, right? Like
Yeah. Yes.
that is my biggest frustration. There are natural ways to get rid of pain. And you guys have created one. And you even have people who are like, I don't want to try anything natural. I'm used to taking a pill. And I'm
Yes.
like, wow,
Yes.
right?
Yes.
You'd rather take a pill and you know what it's doing to your kidneys. You know what it's going to do to your liver long term. And people will say, oh, if I just knew, if you just told them. No, you tell them and they are used to taking the medicine, so they don't want to come off of it.
Yeah, that pain management program, whatever they have, that's like their Bible. We have one nurse, she's a good friend of ours. Like,
Uh,
she takes pain meds, and she's always in pain. We're like, listen, try out. I'm like, wait, we have hundreds of people that
yes,
request to stay. She's like,
yes,
nope, I'm good. I'm like, so you'd rather just stay there and hurt than trying to do
yes.
something that could possibly change. And that's a lot of people, and that's unfortunate. But that's why we have people like you, because like now you're going out, you're putting stuff on YouTube. You got your own Facebook group for your mommies, and you're posting stuff on Instagram. Um, you know, I know this is not the end, but share what your handle so people can find you because for the listeners, she puts out stuff every day on health. Like she favors moms, she favors, but we've worked on it. She'll help guys too. She'll help guys too. So but where are you on social media that people can find you to get some of this natural approach to health, to healthy living?
So rediscover your music. You can find me everywhere on that with that. My website is rediscoveryourmusic.com. And then my Facebook page is also Rediscover Your Music. And then I have another page where guys are more than welcome. I mean, you're welcome to both because here's the thing, right? You need to know what your woman is going through so that you can help her. Because I think a lot of guys who are on my Facebook page, they're able to understand their women more because they can see from woman to woman what we go through. And when they see that, then they're able to help. And so that's Rediscover Your Music. And then Scar Massage is also a page that I have on Facebook. It's called From Scars to Beauty Marks. And you can find me though at Scar Massage. Facebook.com/scar massage. And it is for all scars. I started out helping moms who had C-sections because I realized that they were having the most problem with pain, with numbness, with the decreased orgasms, with losing abdominal fat. But then I took this course and I got into releasing scars, 60 scars. I did them in 30 days. And it was all kind of scars, gunshot wounds, lung removal, open heart surgery, car accidents, Achilles tendon repairs. And I was like, this scar tissue stuff is crazy. And if I could just help, go ahead.
But talk about the relief and the benefits, the people who receive the scar release, because I've had surgery in the military, and you did mine, and it was so interesting, the relief that was provided afterwards. I've seen you do Danette, her scar, and I've seen you do other people, and I know you've done other people. Like, what are some of the benefits? So some of these people are carrying scars for 10, 15, 20 years. And so they just think it's just this ugly thing that's a reminder of something, and they don't know the baggage that they're carrying emotionally and physically. So just talk about, like, and you even call out a couple of people that you've worked with, like how they were before and then what they were afterwards. Because this is one of those areas that people don't know that you can harbor pain in, because I didn't know. I'm just like, okay, this is just a reminder of my scar. I didn't know that there was all this other stuff attached to it until you.
So I love scars. Okay, so one lady that comes to mind, she had a keloid scar, and it was right across the front of her knee. She had a total knee replacement, and she was told, she was in, number one, she was in a lot of pain, and number two, she was told by her doctor that she got all the motion that she was going to get back, and she should be grateful for the motion that she got back. It was months. She was going to PT for like 6 months, and she wasn't getting any more motion, so he refused to approve her for more therapy sessions. So she came to me directly and was like, is there anything I can do? And I said, how much work has your therapist been doing on your scar? And she said, none. My therapist doesn't touch my scar. And I said, okay, let's get to work, right? So emotionally, mentally, for a woman, when we wear dresses, we don't want keloid scars on our knees. And you don't think about that, but it's like, you don't want that, right? Because then you end up, your wife goes from wearing mini skirts to the grandma dress, and you're like, okay, what happened, right?
Right.
And the appearance of the scar matters. And so I was able to help her learn how to massage her own scar, taught her exercises, pool therapy, just different things that she could do to minimize her scar. Asked you to make me a scar potion, right, which you made, and it was wonderful because it not only addressed the look of her scar, but it was able to get rid of the pain so that she could work her scar. Because the problem is, if a scar is painful, you don't want to touch it, right? But if you put something on it beforehand and then you're able to massage it, you can get through that PT session a lot easier, and you're more willing to go back and do it the next day. And so, long story short, over the course of 4 months, her keloid scar was removed, and she was able to go from getting maybe 100 degrees to about 140 degrees of knee bending, and she was amazed. And it's like, what people don't understand is, if a scar is restricting your movement, that restricted movement over time will result in pain. And so restore the movement, decrease the pain, right? And keloid scars are just a different beast altogether. So they do take more time than other scars to get rid of. But that's one story. But the most impactful story, I think, that helped me to realize the impact that scars can have is, there's a lady, and she had a baby 26 years before she saw me. So she had a C-section, and she had been living with pain for 26 years. And her doctor told her, if you want to get rid of the pain, just let me cut you open and get rid of the scar tissue. So in her mind, that makes sense, right? If the scar tissue is causing pain, I'll just have surgery, get the scar tissue removed, and all should be well. But what you don't think about is, scar tissue will come back if you have that surgery, right? Because scar tissue in and of itself is not bad. It is scar tissue that is not tamed. It's like a 2-year-old in and of them. They're not bad, but if you let them wreak havoc around your house, then they will be, right? And then the problem with scar tissue is that it gets stronger over time. And so if you've never addressed it, it's like 1 2-year-old is bad enough. But if you put 10 2-year-olds in one room together, they can really cause issues, right?
That's when you run away.
Right. And so you think about someone so she had that scar for 26 years. When I released it, and it only took, when I tell you it took maybe 20 minutes, she was in tears. And initially I was like, okay, I know this hurts some people, but I really was not expecting it to hurt this badly. And she's like, I'm not crying because it's hurting. She was like, I'm crying because I never thought that I would be separated from this pain. It had become a part of me. And after you took your hands off of me, I was pain-free for the first time in 26 years. But it gets better. Let me tell you, it gets better because she stood up. Her pants almost fell down. Now, it was wonderful. She had been not only harboring the pain, the mental fatigue of dealing with that pain, but she was harboring a lot of belly fat, and a lot of fluid was getting trapped in her stomach. And so with the release, a lot of the times the toxins are able to go out of the lymph nodes where they're supposed to. And she was able to tighten up her pants, because she had lost so much weight around her stomach during that time. Yeah, it was amazing.
You gave her motion back. You relieved the pain that's been there for 26 years.
Yeah.
And she lost weight, and she got yeah. Her husband, her kids, everybody. Your fans are yours.
Everybody.
That's what's up, though. That's what's up. Do me a favor, and before we wrap up, you said your site was Rediscover Your Music. What does music stand for?
Music is an acronym, yes, for muscle flexibility, urinary continence, which means not leaking, sexual fulfillment, internal confidence, and core stability. And I look at those things through the lens of a mom or a woman's diet, exercise, sleep patterns, social interactions, and stress, because that all impacts her ability to rehab to her fullest capacity.
Gotcha. Well, I am so glad. Like, you're our first, right? You had to. So the impact you've had on the two household cannot be measured. The friendship extends beyond time, and so we're grateful. And so I'm happy to have you on here so that everybody can see what makes you excited. I think the only thing that's more exciting to you than healing someone is your kids, right? And it's just amazing to see. So thank you for giving us some of your time. And are there any last words as we conclude the very first Pain Relief University interview?
What's funny when you asked that, because I was going to ask you if I could say something,
I know these things.
Do you know these things? Yeah. Is that, no, I'm really happy that you're doing this. I feel like pain is one of those things that until you experience it, and I do not want to cry on this podcast, until you experience it, you don't really know how badly it can impact someone from a mental standpoint. Mm-hmm. And with my patients, I feel like I take on their pain, because they are so open with me about how it's impacted them. And so when I first tried your product on a couple of patients, or let them use it, I wouldn't say I tried it on them, I saw the pain that they were in. And some of them could not get pain medicine, either because they've taken it and now they have to wait 4 more hours before they can take it again, or they had an addiction and they just don't want to try anything because they're afraid that they'll fall back into those addictive behaviors, or they have been in pain for so long and tried so many different things that nothing is effective anymore. I don't know if you've ever seen someone go from, they're at this level and then they're put on a higher level and on a higher level, and then they get to a point where it doesn't work. It was like every person that used what you all created had pain relief for the first time in a long time.
Mm.
And so for you to now put this together where you realize that, yes, you have a solution, there are also other solutions out there that can work in conjunction with what you have. Because I think about it, there's a lady, and you ask about stories that are impactful. She had arthritis, and I know when it happened, I just wanted to pick up and pick up the phone and call you right away. She had pain that lasted for weeks, and she was laying in the bed, and her daughter was watching her, helpless. What do you do when your family member's in pain? And I had someone yesterday say that. He's like, to watch my wife be in pain and feel like I'm helpless, I can't do anything. That's the worst feeling that a man can have. And I would say for the girl who was watching her mom in pain, that was the worst feeling that she could have. So for me to be able to spray on her hands what you all created, and then her to be able to sleep for the first time in 3 weeks,
Yeah.
it is life changing. And as a therapist, you look at that and you're like, you don't even want to do therapy. I walked out, I let her sleep, right? But then I was like, next day it's on, because I'm going to spray it on her. Once she gets that relief, we finna be doing some exercises,
Yeah.
right? And so it's every therapist's dream to have something that you can just give to your patient, then be able to use it, and then the session is that much more productive, because nobody wants to do anything in pain, and you don't want to make people do things when they're in pain. But
Yeah.
it's like, up until now, I felt like we don't really have good options. It's either everything that we could give them is going to affect their body system down the line in some way, or you can put something on them and it's full of chemicals, which I would never put on myself.
Yeah.
And so I am grateful to you all, not only for having me on the podcast, but for giving me access to something that I can give to my patients and feel good about it when I go home, right? Like that helps me sleep at night. So thank you.
Awesome, awesome. I mean, it's been an experience creating Meg Relief. 'Cause we didn't see that coming, right? We were going in a different direction. But I knew when it worked on me, and then more importantly, when it worked on my mom, I said, okay, we got to do something with this. And then to see it work on, my sister, and then, just other people work on Danette, it was okay, yeah, we got to get this out there. So it's been a good journey. But to hear medical professionals, doctors like yourself, also say, hey, yep, I've seen the results, that in a way validates us and keeps us going, right? Because this particular space is a particularly challenging space, because we're going up against really big competitors. But we know that what we have works, and we just want to share it with as many people as possible who don't want that chemicals or the risk of becoming addicted. So thank you for that, because those words mean a lot. So, but with that, that is the end of our time of part one. We're gonna bring you back.
Thank you.
But thank you. And this is it. So people, if you want to reach out to Katherine, if you have scars that you've been dealing with for years, it doesn't matter if it's 3 decades or 3 days. She's the person. If you're a mom that has leakage, just unfulfillment or pain during sex or incontinence, like, she is the person that to check her out. So go to rediscoveryourmusic.com, set up some time with her, go on Instagram, beg her to get on the Facebook group. You will not regret it. She's helped several people in our household and friends, so I know it's going to be a treat. So, but thank you guys, and we'll see you next time. Bye.
Thank you.
That wraps up another episode of Pain Relief University. I hope that you were able to find something in this episode that you can use and apply to your life to get you one step closer to that pain-free lifestyle. Please like and subscribe to our podcast. Also, leave a testimony. That helps us be seen by more people. And lastly, if there's somebody out there that you know that is struggling with joint pain, share this with them. No one should have to be stuck with joint pain. And hopefully now they know they have options. All right, now, see you next time. Be blessed.